Hello. Today we are going to be talking about respiratory failure. In this video, we will go over what respiratory failure in the dental office looks like, the signs of this condition, and the steps the dental clinician must follow to properly handle the situation. Respiratory failure happens when the lungs cannot get enough oxygen into the blood or cannot remove enough carbon dioxide from it. The body's cells don't get the oxygen they need to function properly, or carbon dioxide levels build up dangerously. It can happen suddenly, acute, or develop over time, chronic, and it usually requires immediate medical help to restore normal breathing and gas exchange. It looks like this. If your patient is in the dental chair and suddenly begins to breathe shallowly, has a look of confusion, or begins to wheeze, they are most likely having a breathing problem. The signs of respiratory failure is cyanosis of the skin and lips, which is basically a bluish tint to the skin as well as the fingernails. Another sign is flaring of the nostrils. The nostrils automatically flare when there is a lack of oxygen going to the lungs. You must remain calm and collected if this happens. You only have seconds to respond efficiently and effectively. You will have a dental staff nearby call 911. Once you have told someone to call emergency services, you will position the patient to sit them upright to make breathing easier. Then, you will provide oxygen. Some dental offices have oxygen tanks next to their nitrous oxide in every dental operatory. You will quickly connect the nose mask and put it over their nose and administer 100% oxygen. Once the mask is on, stay with the patient and help breathe in and out with them while you wait for emergency services to arrive. Suddenly, the patient loses consciousness. First step is to check for a pulse, and you feel they do not have one. After you check for a pulse and any signs of breathing, have someone help you lower the patient onto the floor and use a head tilt chin lift to open airway. At this point, you will begin CPR and use an AED until EMS arrives or the patient regains consciousness. After EMS takes over and the situation has died down, it is important to provide a clear summary and description of what happened and what steps were taken in your notes. Let's do a summary. The situation will look like this. The patient is visibly struggling to breathe, has shallow breaths, shows a look of confusion, and is prominently wheezing. The signs of respiratory failure is the cyanosis of the skin, lips, and nails, and the flaring of the nostrils. The steps to handle this emergency situation is to call 911. Position the patient upright to help with breathing, provide oxygen, and stay with the patient until help arrives. And remember to assist the patient in breathing in and out. If the patient goes unconscious, you will check pulse and any signs of breathing, lower patient onto the ground, lift chin up to open airway, and begin CPR until emergency services arrives.